So much. Hey, we are here today talking about an issue that your dog may deal with as well, talking about coughing or what may seem to be having trouble breathing. Dr. Jerome Williams, our regular guest here on Good Day Alabama, and along with a friend that he brings from time to time, Dr. Sträter-Knowlen, and good to see both of you.
Good morning.
Good to see you too.
Hello,
Thank you.
and who's this?
This is little Addie. She's a rescued Jack Russell Terrier who's now 16 years old.
16 years old.
Yes.
Hey,
I
sweetheart.
imagine you begin to see heart problems as they get older.
Exactly. So especially the smaller breed dogs have very often that so-called mitral valve disease. Talked about this before. But they also have something else. They have so-called tracheal collapse, and your veterinarian may have talked to you about that.
Tracheal collapse, what is that?
So that is when the trachea and the bronchi get weak, especially the muscle on top, and any kind of pressure will make them cough. I'll try to make her cough.
Now the trachea is the
She may
windpipe,
not.
as we call it, correct?
Thank you, yes. So the windpipe is the one, if you put pressure on it with your leash, so always wear a harness, or when you pick them up, and of course she's not coughing here today.
It's okay, she's feeling good today.
Yes, that's very
Feeling good.
common too.
But
that
normally
they don't
she
do
would
it.
cough because it's cutting off.
Exactly. Like this morning when we were not here, all I had to do was push right here and she was going to cough.
Aw.
She has no heart disease whatsoever. And that's actually the
Totally
difficulty.
the tracheal thing.
It's
So what do
just
you
the
do
tracheal.
for it?
It is very difficult to treat. First of all, you have to know, is there a heart murmur present also or not? So differentiate between the cough, it sounds very similar. Is it from the heart or the trachea or both? And they will be treated differently.
Now, is it an aged thing or can it happen in younger dogs?
Some breeds have it earlier, like the Pomeranians can have a very small windpipe, but usually it is something in older breed dogs.
Oh, it's just a sweetheart.
Now what you would do is do echocardiogram and radiographs to see what the size of the heart is, the size of the trachea, the location of the trachea, and that kind of thing.
Exactly. So sometimes if you're lucky, you will even see on that millisecond that it takes for a radiograph, an x-ray, that the trachea collapses. But often you can differentiate, is the heart actually big and pushing on it? Is the dog overweight? Is there any fatty tissue pushing on it? Very important to keep your dog skinny.
That one's, she looks pretty good. So for someone watching now, and you know, obviously there are different reasons why a dog would cough, but is that the most common?
It is the most common when they are older and small breed dogs, yes. Sometimes they have this typical goose honk cough, or some people call it a seal cough. You know what you
Okay,
can do
yeah.
as the owner? Take it on video and bring it to us.
Oh, that's a good idea. Okay, so video the cough, and that way you can see, just in case it doesn't do it in the office, just like right now, and see what's going on. But so at some point, are you just kind of keeping them comfortable if it gets so bad?
It sounds much worse for the owner than it does for the dogs.
Yeah.
And it's really true that we can treat it, but it's not easy.
It's not easy.
And I usually
okay.
only try to treat it with many phone calls over the years and manage it.
Okay. All right. Well, that's the price of aging for all of us.
All
Things start
right.
to happen, doesn't
And it's
it?
so good to have someone like Dr. Sträter-Knowlen available. That's a cardiologist to
So
help
you're
us
she's
evaluate.
basically a cardiologist for animals.
For animals,
Yeah.
yes, yes.
All right.
Because those of us as general practitioners, you know, we just don't know how to diagnose and treat
not-
in that
It's not your
specialized
specialty.
area.
Not your specialty, but you would refer to someone like her.
Absolutely.
All right.
Thank you.
All right. Well, thank you, Ingrid. Good to
Thank
see
you.
you. and
Good to see you again.
I'm glad to see you're doing well this morning, buddy.
Yes, thank you.
Probably start coughing right when we go off here. Thank you both for being here. All
Thanks
right.
for having us.